So we're beginning to explore PAM. It'll be used a lot within our system. One of the things that we want to do is really focus on all these areas when you're following patients. We often talk about prevention because it's built into our systems to kind of track. Medical care encounters is why we're using a lot of the links to be able to get to the offices, and whether they're behavioral primary care, really follow that throughout the whole process. We're trying to get a lot of information to you guys about behavioral so that things are followed a different way. Utilization from the hospital, and we'll see how PAM, which is the patient activated measure, will help. The workplace, that's where you're going to kind of help with trying to get people back into work, but also being able to have them control and manage their conditions. Medication use is crucial, and we'll see how important that whole thing is to the system. And lifestyle behavioral changes. I think that in itself, to try to get people to exercise more and pick out the people at risk, will be important in this whole process. Disease-specific behaviorals, and that's where we're getting into a lot of the diabetes, and we'll show you some examples as we move along, and the biometrics in terms of how we're going to follow that. So in terms of PAM, there are different levels. We have level 1, 2, 3, and 4. And 1 is bad, 4 is good. So level 1, for example, talks about starting to take a role. Individuals do not feel confident enough. And that's the biggest problem that we run with the patient that we see. If you look at, in terms of the disengagement, overwhelmingly these individuals are passive and lack the confidence and knowledge. And we're hoping, as health navigators and community health workers in our team, that we can see patients, stratify them. But you know, a lot of our patients are levels 1 and 2. These are the questions that are asked by the patient-activated measure. And so you're getting into things where it was developed in the University of Oregon, but it applies to a lot of what we're doing. And so these are the questions that are asked, and based on these questions, we'll have a workflow that gets developed. So again, these are the 4 levels. If you notice that 15 to 20% of the population is level 1 and 20 to 25% is level 2, we fall into that range at this point. Now, PAM kind of helps because when you're dealing with diabetes, you'll notice that if you are able to significantly change the PAM score by 1, there is ER decline, better diabetic control, and better cholesterol controls. So the idea here is that you really want to focus on PAM and get PAM to a higher PAM level. HIV, the same thing, that if we're able to get better CD4 understanding, better medication adherence, and viral, you're getting improvements in PAM, and as a result of that, you're getting better results with patient care. So again, this kind of looked at a couple of different things. So if we look at the PAM levels, which are up here, and illustrated by the colors down here, for healthy behaviorals, you notice exercise. In this particular group, it's low. Disease-specific self-care behavioral, if you look at taking their medications, it's low. If you look at preventive behavioral, getting mammograms, which is what you guys are helping, it's low. And why is PAM so important? PAM in the lower 1 and 2 are significant costs to the system. If you look at PAM 1, this is what the cost would be for a patient, PAM 2. And so we're trying to really get people from a PAM 1 to a PAM 4 in terms of management. Now in the hospital, interesting enough, the trend where the arrow is showing is these are low PAM scores, so there is a higher significant readmission rate for that population. Now low activated patients struggle, and so a lot of what we talked about was medication management. And this is what we're trying to do with you guys to be able to get the charts and get a little bit better with the medication input, but learn more about the medications. The biggest thing is to make sure that they're refilling them and that they're taking them. If we look at knowledge of the symptoms, so the symptoms and signs, again, you're looking at a PAM 1 where knowledge is something that you need to watch for. Now here we're looking more at experience with healthcare providers. So, they're bonding, they're talking to the providers about diet, exercise, and self-management. And if you always see PAM-1s, which is a lot of the patients that are in the health home, why we're doing what we do. Here it sort of looked at the positive emotions, how do they feel overall with goals, orientation, feeling overwhelmed. And what you see there, more important, is that there's less negative emotions in a 4 than a 1. Again, what we want to do is once we get all this information is you begin to understand the diagnosis, and then you begin to understand the medical side effects and the warnings, be able to get the medications, make sure these patients are taking it, they're monitoring. So it starts to give you the flags to make appointments, the things that are important based on the PAM scores and some of the information you get from the patient. Again, you're seeing the tailoring, the self-management, and what you end up doing to try to achieve and get to the level that's important with PAM. Now again, tailoring it by coaching. And what happens is, as you know, is this up here is not good in terms of what you want to see. You have a coach activating system that you go through once the PAM is established for the different conditions. Okay, and what's good about that is it starts to give you to set goals. We already do some of these things, but we're going to integrate more of it into our system to give you at least an orientation, key areas of self-management, and reinforcing a lot of what we're trying to do with printed and email materials. Again, the goals and actions are different. So if you got a PAM-1 and a PAM-2, and you're both treating the diabetes, it's going to be managed different, if you can see going down. So, they become aware of portion size and start the journey to right size. And while here, they're developing a carb counting routine. So you're dealing with 2 approaches to management. And what we want to do is kind of give you the tools for that when PAM gets implemented. Here, it tells you in terms of the teams that we'll be developing depending on the PAM scores and the acuity of which providers in the system will be doing certain things. Our coaches do really well with a PAM-3 and facilitators, but when you get into the level 1s, we need some supervision, and that's where health navigators can really do a great job. Again, ER and urgent care decline. A lot of this was seen, again, if we are able to get people to improve their PAM scores. So 47% increase led to all this improvement in terms of 24% increase in appointments. Patients were satisfied, which is a problem we're running into because we want to make patients aware of what we're trying to do. That does work. Improve adherence and control of diabetes, which was pretty good. Again, applications where it does reduce admissions. We're talking about the things that we want to have the health navigators and some of the community health workers to do, is really to do in-home visits and just watch these patients. Sense Health and some of the systems we have at the MedDent and at the office in terms of appointment reminders and medication follow-ups. So make sure they come to the doctor, that they get their medications, that they're taking their medications. This is a monitoring system, and that's where health navigators and community health workers can really do a great job at. You can tailor a lot of things. So, look at things that overwhelm and create some red flags that you need in terms of the goals. And we've been giving you some of these skills at Gbuahn, so we're hoping you begin to implement them. Again, once you've done the measures, then you segment the populations, which is what we're trying to do. We begin to have the health navigator tailor what we do for these patients. But remember, you're constantly reevaluating yourself from time to time. Now, PAM, again, goes back to all these different sections, will be very useful. It's actually a software that we'll be using pretty soon. I wanted to give you an orientation on it for now, but that's it. Thank you, Dr. V.